While he's putting that on for me, I just want to again, I'm Dr. Bernard Abbott. I'm the medical director at South Baltimore Family Health Center, and I've also been a preceptor for medical students at the University of Maryland for about, I lost track, maybe 8 or 9 years. And also I work with Arlene at Hopkins School of Nursing with the nurse practitioner students. So I really want to thank you so much for sending me some of the best nurse practitioner students I've ever had. I want to talk to you today about asthma, okay? And particularly about adherence to medication. Now, why is that important, okay? If you asked me 10, 15 years ago to talk about that, I probably would have said, I don't know if I'm really able to do that because I didn't have enough information, enough knowledge personally, because it scared me to have to come in front of a group of people and tell them about asthma. Now, why? Well, let's see if this works. It does. Give you a couple case studies. Number one is a 7-year-old female with a history of mild asthma, typical case. Used albuterol steroid inhalers, okay, hospitalized 2 times at age 3 and age 4, but has been well since then. No respiratory distress over the past 3 years, okay? Case number 2, 14-year-old male with chronic asthma in foster care, being taken care of by his grandma, okay? Non-compliant with meds, again, not an unusual situation with adolescents. Numerous hospital admissions over the past 5 years, okay? Now, why did I bring this up? Both of those kids died from their asthma, okay? All right, just to let you know, this is a serious discussion we're having, all right? This was not a random conference that they just said, hey, let's do a conference on something, okay? It's a real serious problem. Now, what are some of the barriers that I have to deal with on a day-to-day basis? I've been at Cherry Hill for 27 years, 27 and a half years, so I'm into my 3rd generation of families. Now, that's important because when I walk into a room, I know the history of that family, okay? A lot of the medical students who come and nurse practitioner students who rotate, they walk in the room and they know nothing, okay? So they spend an hour and a half doing a history and so forth and so on. I walk in there in 5 minutes and I'm done because I know the history. So I have that advantage. But if I don't know that patient, I have to take time, especially if they have asthma. Making the diagnosis is very, very important, all right? Not always easy, okay? Giving the right medication, of course. Health education and compliance. Arlene talked about health education. One thing they always tell me, Dr. Abbott, you need to educate your patients. You need to teach them. And I say, I've been trying to teach them for 27 years, okay? All right? They know what I'm going to say before I say it. We do the best I can. Now, let me emphasize, too, I'm not talking about you guys, okay? I'm not talking about me. I have a daughter. Fortunately, she does not have asthma, but if she did have asthma, I guarantee you, she would be compliant with her medications, she would take it properly because we know. I'm talking about the families who don't have that luxury of having family members who know how to take care of them, the people that I see 90% of the time. Lack of insurance is always a problem, and social, economic, and family issues. Dr. Diette talked earlier about diet and so forth. I give a lot of talks on obesity in children across the country, and a lot of what he said, you don't mind if I use some of your slides, do you? Because they were great slides. But diet is so important in terms of how a family reacts to not just food, but the environment and so forth and so on. Now, what about making the diagnosis? Okay, physicians generally have a hard time making a diagnosis in children of asthma. Why? Because the symptoms are so subtle at times. Now, if they come in the office and they're wheezing, it's no big deal. But what does mom say when she brings her little three-year-old Tommy in? He has asthma. Well, how do you know? I know he has asthma because my great-grandmother had asthma and he sounds just like her. And I said, well, do it for me. What do you mean? Well, how does he sound? And they go, I said, Mom, that's not asthma. Yes, it is. No, Mom, that's not asthma. Let me listen to him first and then we'll decide, okay? So I listen to them, and they assume any child who coughs, who has a cold, and who has a stuffy nose and sneezes has asthma, until proven otherwise. Why? Because grandma had it, my uncle had it, my older sister had it, okay? Coughing, the only thing sometimes that is truly an asthma attack. Now, as a doctor, I'm sitting there, I'm saying, well, most of my kids have colds, especially in the wintertime. Do they have asthma? I don't know, all right? I tell most parents, under the age of 2, generally under 18 months, I don't like to make a true diagnosis of asthma unless I've had 2 episodes of wheezing that responded to albuterol or treatment. Then I'll say, okay, Mom, I think your child has asthma. Why? Because I don't want to label a child as asthmatic if I don't really have to, because it follows them all through daycare, preschool, kindergarten. And if the child coughs once, school nurse is like, you have to come get him, okay? And what happens then? They come to my office mad as heck because they had to leave work, and then I tell them, oh, it's just a cold. He's not wheezing. Well, I don't understand why, and they get upset. So I have to deal with another emotional problem, okay? Upper airway congestion, that runny nose, again, can be a problem. Shortness of breath after exercise. Again, very common in my older children, 6 and older, and the adolescents. Again, if they get short of breath after playing sports or running on the playground, I'm going to assume that's asthma until proven otherwise. Decrease in activity, again, most kids between 18 months and 6 run everywhere. If mom tells me my child is not running a lot, doesn't want to play, that's a red flag. And of course, difficulty sleeping. The child who wakes up in the middle of the night coughing, again, 15 years ago I may not have said asthma, now I think, okay, does this child have asthma? Prescribing the right medication, okay? Big problem. Why? Because 10, 15 years ago, I was afraid of steroids, all right? I was taught way back when in medical school, only use steroids in the last resort. Now it's just the opposite. I'm afraid not to use steroids, okay? Because I don't want to have that child develop inflammatory lung problems down the road, okay? But mom is still afraid of steroids. Why? Because is my child going to get big, okay? And you have to take time to explain that to mom, okay? Albuterol. The problem with albuterol is a great drug. As Tom knows, there's so many different types of albuterols out there, brands, okay? So what happens, mom will come and say, Dr. Abbott, I want Pro-Air. Right. Well, I write Pro-Air, but the insurance says, no, we're going to give you Ventolin or something else, or albuterol generic. They come back upset because I'm giving them the wrong medicine. Got to spend 5 more minutes explaining to them, no, this is what the insurance, now again, you're laughing, but this takes time, okay? This puts stress on the provider because we know we have to do this, okay? Handheld inhaler or nebulizer. Well, we're lucky. We have a respiratory supply company that gives us free nebulizers. I don't know where they come from, okay? I don't ask, I just say thank you, okay? And he came by last week and he was in the hallway going through the closet, and I jokingly said to the nurse, if you see the respiratory guy, can you tell him to bring some more nebulizers? And he heard me and came back and we were laughing and joking about it. And I tell him constantly how much we appreciate those free nebulizers, okay? The problem with the nebulizer is, do I think that child is the only one using that nebulizer? No, of course not. It's being passed around. No, I used to think just the house, but it's the neighborhood now, okay? All right, next door neighbor had to use it because grandma, And if they just clean the filters out every now and then, they wouldn't break, but that's a whole nother story. So, and then handheld nebulizers, okay? I don't know how much time you guys spend. I spend a lot of time trying to teach them how to use a handheld nebulizer, okay? It just comes out the side of the mouth. It's just a real nuisance, okay? So unless I'm really comfortable that they can use it, I'm nervous, all right? Yes, like you said, Arlene, they use that albuterol all the time. They want more prescriptions. They don't even come to the office now. They just call up and say, can I get a prescription? Can he just fax it to the pharmacy? Can he call it in? What would you do? Do you not fax it in because you want to see that patient? The nurse says, Dr. Abbott, he hasn't been here in 6 months. I said, I know. What do I do? Do I not write it, thinking, okay, maybe he's wheezing at home? Or do I say, okay, no, you got to bring him in? And why can't you bring him in? Well, she's at work. She can't get in until 4 o'clock, which means she won't get in until 5, right? Put her on the phone. Hi, come in now. I can't. Okay, what time can you get here? 4 o'clock. Okay, how you gonna get here? Well, I gotta take the bus. Oh, no. All right. Again, you're laughing. Typical day. Okay. Now, I can stay till 5. Okay. No, I can't because I got to go home and feed the dog and cook dinner. But generally speaking, the nurses want to go home. So if I say come in, that means they're going to have to wait. And then they're mad, okay? So what do you do? You write the prescription, say come in. Can you come in tomorrow? Can you come in the next day? All right? Are you taking your steroids? What steroid? Your Flovent. What Flovent? Okay? You begin to see the problem, okay? How much should you give? Oh, before spacers. I love spacers. You know how much they cost? About $30, $35. In the good old days, when Tom and Teva and all the other drug companies would give you free ones, they don't do that anymore, okay? And now the insurance will only pay for one, okay, right? albuterol inhaler, number 1, with spacer, can't write that anymore. You get a report back, no more spacers. So I hide them, they're like gold. And for my very special kids who I think will use it, I bring one out. All right, go get a spacer, all right? And they have to lock and key, and they're in the case because they're that important. Now, how much medication should you give, okay? That's another problem. Parents are so afraid their child is going to end up in the emergency room, they overdose, okay? And you all know albuterol and overdose can be very, very bad for a child, okay? So again, it requires education, education, education. Lack of insurance. About 65% of our patients have medical assistance, and that is decreasing, okay? Which is surprising to me. Why do I say that? Because I saw the child last month, had insurance, they come back for a follow-up, Dr. Abbott, so-and-so doesn't have insurance. I said, yes, they do. No, it's not valid. Why? Because mom didn't send the paperwork in, right? State of Maryland is not broke, but they're very, very strict now. If you don't get the paperwork in for the follow-up, you're not going to get your insurance, okay? What do I do then? Samples, all right? So I am very, very nice to the drug reps, okay? There's one looking at me right now, and he's a great guy, okay? I love his company, because I can go in that room and get a sample, okay? And they don't realize how valuable that is for a lot of patients. I have adults who come to me all the time saying, can you give me an Advir? Can you give me this? Who's your doctor? You are. No, I'm not your doctor. Okay? All right? Go to your doctor. The doctor is right down the hall. I don't want to go there. Why? They don't have insurance. And I don't want to have to deal with Dr. So-and-so because she's not going to do it, and I don't want to have to deal with that, and I know you'll do it. So what do I do? Should I give it to her? I don't want to, but I feel obligated because I'm afraid if I don't, she's not going to do well, okay? How am I doing on time? Okay. Again, we talked about our patients taking medications properly. Most of them are not. My daughter would because I'd make sure she would. Your kids would. You would, okay? Okay. Who is really using the medication? We talked about that. And does the patient and family understand the medication? I really talked about lack of education. So, again, school nurses, very valuable. I'm not going to talk about school nurses because I love them. My mother was a nurse. I'll talk about that in the closing session. And finally, heard a lot about environment. I'm not going to get into that. In conclusion, it's a serious problem in our communities, severely underdiagnosed, okay? Increasing number of kids who are uninsured, which makes it more of a problem. Be aggressive in your management of asthma, okay? Don't be afraid to treat, okay? Take advantage of city asthma resources. As you've heard, no child should die from asthma. Thank you.